You are listening to the Health Source Podcast, presented by the Marshall Health Network. Now here's your host, Rick Lord.
Hello again, and welcome inside the Marshall Health Network studios on the campus of Marshall University. This is the Health Source Podcast, brought to you by the Marshall Health Network. And today we are going to be talking about a topic that sometimes falls through the cracks. People might not think about it too much. When we put together a comprehensive health plan, we say to ourselves we want to be healthy from head to toe, but sometimes it's that latter part that gets overlooked, the toe, the feet. And with that in mind, we are going to be talking to a podiatrist today. We want to welcome in Yuna Farah-Peterson, a podiatrist with the Marshall Health Network and also an assistant professor at the Joan C. Edwards School of Medicine. Yuna, thank you for your time today. We appreciate you being here.
Thank you for having me.
And I was talking a little bit before the show. Sometimes when we're talking about feet, I can get a little punny. So, if, let's walk us through the steps. Let's jump into it. So if you feel I'm getting a little too overboard, you can feel free to step in on that one. But just talk a little bit first about your background, your credentials, how you got involved in podiatry, and what led you to the Marshall Health Network.
Yeah, so I did my undergrad at UMass Boston. I was looking for a sports medicine program to do after college. And then I started getting information from Kent State Podiatry, and they have a very strong sports medicine focus there. So I applied, I got in. During my time there, I was also able to get my master's in healthcare administration as well from Purdue through an online program. I graduated in 2020, and I did my residency in Alliance, Ohio. We covered 14 hospitals surgically. And took call at one, and from there I moved down to Point Pleasant, West Virginia.
Great part of the state.
Yes.
And it's interesting because you brought up the sports angle, and we'll touch on that in a little bit too, because there are many. It's a multifaceted thing here with feet.
Yes.
And foot care. You're talking about physical injuries and sports related injuries possibly, and exercise related injuries, but also foot care can tie into a lot of other ailments that people might not even consider, and one thing leads to another, and then it can cascade. And it's topical now because April is Foot Care Awareness Month. So first of all, let's begin with that, because I know there's a strong connection with diabetes and feet. But what are some other things and you can include the diabetes in that as well, that people might not be considering when talking about foot care and how it relates to their overall health?
Yeah, so I always tell my patients that your feet are like tires you can't change, right? So as time goes on, you're going to wear out the tread on those tires. And eventually, you're going to probably have some aches and pains that you would like addressed. While there are surgeries and joint replacements in the foot and ankle that can improve your quality of life, you'll always know that you had something done. And I always like to tell my patients too that your feet are the windows to the rest of your body. You can diagnose and treat autoimmune diseases, blood flow issues, cancers, and so much more just based on what you see in the feet alone.
That's amazing. So I want to talk a little bit about that, because that's something that a lot of people wouldn't even consider.
Yeah.
Just give us an example of something that you can diagnose just by looking at your feet.
Yeah, so I have a lot of patients that come in who are, for example, in their 60s or 70s, and they say, hey, like I've had a lot of swelling in my ankle recently that's just been bothering me a lot. It happens every once in a while, but right now it's been bugging me and I can't really walk on it. We'll do the standard blood work, but what usually comes back, or not usually, but what comes back sometimes is that they test positive for some autoimmune markers. And then they find out that, they have a rheumatoid arthritis that they didn't know that they ended up passing on to their kids, or they have Sjogren's or other autoimmune issues that they didn't know about.
That's interesting. So there's some obvious signs. You look down at your foot, it's swollen, it's purple, it's discolored. You're like, okay, something's not right.
Yes.
Are there other things that maybe might be more subtle, or that people might not be aware that could be worse than they think?
Yeah. Melanomas, squamous cell carcinomas, for example, a lot of skin cancers, basal cell carcinomas, they're very common in the lower extremity. They're relatively easy to biopsy, but patients just kind of chalk them up to, here's a spot I developed, or it's a sunspot, and they don't really think twice about it. I've had several patients come in with history of different types of cancer. There's always concern with a patient who has a cancer that has metastasized to their bones, for example, if they start to develop foot pain, did it go to their bones? It's very rare, but it can happen in the feet.
Now, you talk about self-diagnosis, just taking off your socks and looking at your feet every day, but are there other screenings that you would recommend for people that they might not be thinking of when they're getting their primary care or just their regular checkups?
Yeah, so I would encourage when they go to their primary care, just ask your primary care doctor to take a look at your feet. It's very difficult for patients to actually, torque their leg to be able to see the bottom of their feet. And primary care, I'm sure they'd be more than happy to do that, to just look at the bottoms of their feet, because they can find all sorts of things. They can find wounds that you didn't know about. They can find ticks in between your toes. They can find things that you might have stepped on and you didn't know. And if they can't take care of it themselves in the office, they can always send you to a podiatrist who can.
And a lot of times you don't think about that because you're walking around on your feet all the time, and you could step on something and you might not even feel it, and then you get infected, and that can lead to something else.
Exactly.
The diabetes thing,
Yes.
I think, is a huge issue because in the state in particular, the numbers show that it's a bad. We have a bad percentage of people with that ailment, and there is a link. You hear a lot about people that go with untreated diabetes that end up having their feet or their legs amputated. What is that connection, and what happens that leads to that type of diagnosis?
So a lot of diabetics, first thing is they don't realize they're diabetics. They're diabetics for 20 years and they don't get diagnosed until they get extremely sick. For example, when it gets that bad, or even if they've just had diabetes for a long time, they develop what's called neuropathy, and it's a disruption of your nerves in your feet and your hands, because your feet and your hands are the furthest away from your heart and your spinal cord. They're the first to be affected, essentially. So when you have diabetes and you develop the neuropathy over enough time, it starts out with like burning, tingling, numbness, or burning and tingling, excuse me, and then it can develop into numbness. And when it develops into numbness, that's when patients start stepping on things and not realizing it. Additionally, diabetes lowers the quality of your immune system, so you can't fight infections as quickly or as well as most other people would. So when you develop an infection, instead of it healing up really quick, you might be stuck with an open wound that takes 3 times as long to heal. I usually tell my diabetic wound patients that we're looking at an average of 3 months for healing if you have great blood flow.
3 months, wow.
Yeah. And if it's sooner, great. If it's longer, we're not surprised.
So is there anything that is in the realm of specific diabetic foot care? I mean, obviously you want to treat your diabetes, and there's the insulin that's involved with all of that. But is there anything specific that links the two that you can specifically treat your feet and the diabetes at the same time?
It's more about being self-aware and, like you said, keeping your diabetes in check, but also checking your feet every single day is super important.
And understanding what to look for and what
Yes.
okay.
Yep.
Because I'm always amazed at how that link is. When you're diabetic, you think, okay, I understand parts of it, I don't understand everything, and I'm self-aware enough to know that I don't know anything about that. So that's it's informative, because a lot of people might not understand why the feet are so involved in something like that.
Well, and that's the other thing too, is that the goal of diabetic foot care, especially within podiatry, is to prevent patients from reaching the point where they have to get an amputation.
Right.
And once you start getting an amputation, whether it starts with a toe, you're at higher risk for more higher up amputations, including losing your leg. And I usually tell my diabetic patients, if you lose your leg, you're kind of on a countdown over the next 5 years or so that you might pass away in the next 5 years.
Yeah. And when one thing leads to another, so it's more preventative is the way to go, not to get to that point in the first place. So where can people go within the Marshall Health Network? What kind of services are offered in that network that might be close to them, or resources available for them to do that?
Yeah, so we actually have a lot of places in Huntington. Dr. Avery works out of the Cabell Wound Center in Marshall Podiatry in Huntington. Dr. Borowski works out of both Taze Valley and Huntington. Dr. Brown works out of Scott Orthopedics in Huntington, and Dr. Feaster works out of the Cabell Wound Center, Marshall Podiatry, and she also works out of the Ebenezer Medical Outreach in Huntington, which is a free clinic for uninsured, underinsured, and Medicaid patients. Dr. Peterson works out of HIMG and St. Mary's Wound Center, and Dr. Miller works out of HIMG and St. Mary's Wound Center as well. And Dr. Tankersley works with Marshall Orthopedics in Huntington, and I'm in Point Pleasant at Rivers Health through the hospital and the wound center.
So what I'm getting at, there's a lot of places.
Yes.
There's a lot of places,
Yes.
a lot of resources available. So just Google Foot Care Marshall Health Network, and
Yep.
you're probably in decent shape. We talked about trying to make sure it doesn't get to the point where it becomes a huge issue. Are there preventative screenings other than just going to your doctor and saying, hey, look at my feet? Are there things that, even if your foot appears to be fine, before it even gets to that place, are there screenings that are involved that people can get, that where the doctor will just check you and be like, you know what, you're good to go?
Yeah, I always say it starts at home.
Yeah.
So taking like a long handheld mirror and checking the bottom of your feet every day if you can't reach your feet yourself, or asking a family or member or friend to do it. Also, I always tell my diabetics too, it's important to, if you're going to get in the bath or if you're going to do a foot soak, check the temperature of the water with your elbow and not your hands. Because if you're diabetic, like I said, you start losing the feeling in your hands and your feet. You won't be able to adequately assess the temperature of the water. You can burn yourself if you're not careful. Making sure that you're wearing shoes that don't cause pressure spots is huge. And then checking in with your podiatrist, honestly, regularly is super important as well. I like to see my diabetic patients every 3 months. On average, sometimes sooner, sometimes a little bit longer, depending on the individual patient. But we don't just trim nails during those appointments, which kind of, when the nails get long and thick, especially in diabetes, they can injure the patient. But also, I check to make sure that your blood flow hasn't changed since the last time you were here. You haven't stepped on anything since the last time you were here. You don't have any pressure spots that need addressed and things like that.
Now, there's also a physical component to foot care, and especially in an aging population. You hear the term "my dogs are barking," and it just seems as you start getting older, your feet, because you're on your feet all the time, and they start hurting. I played sports as a young kid, and I got plantar fasciitis. And as a teenager, I'm like, this sounds like something that should be an old person's disease. But I mean, there are physical ailments that are involved with your feet as well. What are some of the more common ailments that you run into, and how can people prevent that, especially if they're on this journey to wellness and trying to exercise and trying to be more active? Your feet play a huge role in that.
Absolutely. So in terms of what common ailments I see, I mean, I and my other fellow podiatrists, we treat anything from ingrown toenails and fungal toenails to plantar fasciitis, Achilles tendonitis. We treat traumas like foot and ankle fractures, Achilles ruptures. We address limb deformities like foot and ankle deformities. And wound care below the knee is also huge for us, and focusing on limb salvage. With regards to your question about, could you repeat that? I'm sorry.
Well, I don't even know if I asked a question, so that's probably my fault.
I think you said something.
I think where I was going with this is, there's a difference between, you walk 2-3 miles, you're like, man, my feet are sore, and there being a real problem. So at what point when you get home, is it, okay, this might be something that needs to get checked?
So typically, I would say if it happens multiple times a week, if it's something like you've noticed your feet aching at the end of the day after work, and the pain is progressing, and you feel like nothing that you're doing is working, especially, or even if you haven't tried anything, you can always stop in. Sometimes there are really simple ways to address that, like inserts or compression socks or things like that. There's obviously the traumatic events where, you step down or you twisted your ankle and you just have really bad pain and swelling. You can't walk on your foot. That's always, you can go to the emergency room, urgent care, or call in to see if your podiatrist has any appointments for that. And just when it comes to trying to be more active and taking care of yourself, I always try to tell patients, don't go too hard too fast. Like, you don't want to go from, walking a quarter of a mile a day to trying to do 10 miles in one day, every single day for the week.
And there's a psychological element to that too, because you
Yeah.
burn yourself out,
Yes.
and then it's easier to quit. You're like, I can't do this.
Exactly, especially when things start to hurt.
Right.
So.
And as we mentioned with the health component, even with the physical component, one thing can lead to another. So if you're not taking care of your feet, then all of a sudden your body overcompensates, and that can lead to other things, I'm sure, as well.
Yep.
So what are some of those elements that like if you have undiagnosed plantar fasciitis and you're just walking around going, well, my feet hurt, but at least it's just my feet. What could that lead into if it's not properly treated?
Can lead to Achilles tendonitis. I start seeing patients who develop knee pain and hip pain because they're trying to walk on the outside of their foot instead of the inside of their foot. That can always lead to lower back pain. So it really works its way up the chain. So,
what is the I don't want to use the word craziest because there's no such thing as crazy. Everyone has their own health, and things can get wonky quickly. But what are some of the more interesting cases that you've seen of people with foot problems?
So, I mean, I had a big one that we finally resolved after a year since getting out of residency. I had a guy come in who hadn't walked for a really long time. He was seen by 2 other surgeons and told, you need to cut your leg off. Like, this isn't going anywhere. He had really bad wounds to both of his legs, but his right leg in particular, when you looked at it, his foot looked like it was at a right angle to his leg. So we ended up getting x-rays and found that the talus, which is the bone that connects your foot to your leg, it was completely dislocated and his foot wasn't really attached to his leg anymore. So that was an interesting one. My husband is also a podiatrist, so we ended up scrubbing the cases together, some of the cases, because they were very long and very involved. But what we ended up doing was we got his foot back under his leg. With all the surgeries that he had, it was probably 20 hours worth of surgery, a year worth of wound care, and he ended up healing and walking again. So it's worth it. Like, those cases really make it worth it.
Yeah, and I would imagine in things like that where there's not a lot of precedent or something that's unique, it can be challenging to properly diagnose that and to go through all the steps of what's going on here and how do we get to this point. What led you into this field? At what age were you like, you know what, I want to be a podiatrist?
Well, I knew from a very young age that I wanted to do medicine. I was in the hospital in and out as a kid growing up a lot. And I really felt impacted by the people that took care of me, and I just knew I wanted to take care of people. And like I said earlier, podiatry was honestly a happy accident for me. I was just kind of looking for something the sports medicine route. When I got into podiatry school, I fully appreciated podiatry for what it was.
Light came on.
Yeah, and I was like, oh, I love this. Like, I want to do this for the rest of my life.
I want you to be honest with me. How many times has someone come up to you and you're like, yeah, I'm in podiatric care, and they're like, oh, kids.
Yeah.
And you're like, no.
A lot.
Pediatric. I mean, it's one letter, but that's a big difference there.
A lot.
But kids have feet too.
Yep, that is true. That is true.
Yeah, I mean, I think I was like a teenager before I realized, wait, podiatry is not pediatric. Okay.
Yeah.
Podiatry, foot, I get it. Okay.
My favorite was typing it out in the computer and it auto-correcting to pediatrics.
Oh, right.
So that was always great.
And we don't want to get in the conversation with what my phone auto-corrects because we'll go down a bad rabbit hole on that one. So when you're talking about, overall foot care, I want you to give us the easiest thing that everybody can do right now as they begin or continue their path to wellness to make sure that they're taking care of their base, of their foundation, because we opened the show by saying it literally is the foundation of your health. So what's the easiest thing that everyone can do right now as soon as they're listening to this to make sure that their feet are in the best health condition that can be?
Proper shoe gear. So I always tell my patients, because they ask me, like, what kind of brands of shoes do you recommend? I don't like to recommend brands because different people have different needs.
Sure.
So I always tell patients, you should not be able to fold your shoe in half. It should only bend in one spot, and that's at like the big toe joint. That is the only place where you should be able to bend your shoe. If you can fold your shoe like, folding a towel, it is not supportive for you. It's going to make everything hurt. And also it doesn't.
So I don't mean to cut you off here, but when you say big toe joint, all right, so this is the shoe that's up here is the only place that it's.
So like up in this area. Yep.
Okay. Yeah.
Yep.
If you're folding it in half,
It's not a good shoe. Yep.
And you get what you pay for.
Yes.
So
Yeah.
don't skimp on those good shoes, especially if you have foot pain or foot problems. Do insoles work?
Yes. So, and it depends on the type of insoles. So again, it depends on the patient. Some patients benefit greatly from really soft insoles, and other patients who require more support should look for semi-rigid insoles. I have inserts that I give out in my clinic all the time for patients, and most of them feel better right away when you put them in. It doesn't matter what's outside the shoe; it's what is inside the shoe that counts too.
So we'll get you out of here on this. Talk a little bit about your relationship in the Marshall Health Network, what it's meant to you to be a part of it, how they've been treating you, and what you've learned as you've gone through this process.
Yeah, I'm very grateful. I feel very fortunate that I have a network of providers that I can go to if I or my patients need anything. Being up in Point Pleasant, we don't have access to vascular or interventional cardiology directly within our hospital. So it's so nice to be able to send our patients down to St. Mary's and be able to follow them there and then bring them back and continue to take care of them once they get the care that they need. So a lot of podiatric patients, especially diabetics, have blood flow issues. So that has been my biggest focus, is making sure that my patients up in the Point Pleasant area get the blood flow addressed that they need. And it's been amazing being able to network through Marshall Health and get them the care that they need.
And if you are listening to this, by the way, on Spotify, make sure to like and subscribe so you'll know when the newest episode comes down. We can't do this without your guys' support as well. But I know you rattled off a huge list of providers, and the Marshall Health Network will be very, very proud of you for doing that PR for them. But specifically for you, I want to give you a chance to let the people know, because Mason County is one of the growing areas in the region, especially with the new core plant going in. There's going to be a lot of people that are coming in here that might be looking for this type of care. Specifically, how can someone reach out to you?
Yes, so I don't require referrals. So if a patient wants to be seen, they can call my office. I believe the number is 304-675-2781. They can call my office and set up an appointment. I am in the office, the clinic, Tuesday through Friday. Mondays are my surgery days and my wound center day. So if they needed to get a hold of me or my office, they can call there. They can call the hospital directly and ask for the podiatry number. If the wound center if our patients need to go to the wound center, they have open wounds from head to toe, essentially. We are working to, sorry, my brain just blanked.
It happens.
If a patient needs wound care, they can call the wound center and get established there. So.
Okay. Well, we thank you for your time today, and a lot of good stuff and a lot of information that people might not have thought about. And again, April is Foot Care Awareness Month, so it was topical. Yeah. And we always love hearing from people that know the field and can help you on your path to wellness. And thanks again for joining us. Again, we'll be hoping to bring these to you every other week, so keep track of what we're doing here at healthsourcewv.com. And again, you could always find us on Spotify or Apple as well if you prefer to get the audio version of the podcast. And be sure to like and subscribe. Yuna Farah-Peterson, thanks again for your time, and thank you for joining us today. Until next time, I'm Rick Lord. Take care.
That was the Health Source Podcast, presented by the Marshall Health Network.